difficulty in extending the right middle finger since 3 months. History of present illness. The child presents with inability to extend the right middle finger since 3 months, which was insidious in onset and gradually progressive in nature. There is history of difficulty in eating and holding large objects with the right hand. The child was apparently normal 6 months ago, after which she sustained burn injury to her right hand by accidental spillage of hot water while playing. There is history of blistering over the right middle finger, palmar aspect, at the time of injury. The child was taken to a nearby hospital where she was admitted for 10 days. Should I start again?
No, sir. You just show the photograph for now. 3 months old, 5-year-old child.
There is history of blistering over the right middle finger palmar aspect at the time of injury. The child was taken to a nearby hospital where she was admitted for 10 days and was treated with dressings. The parents were advised about the probable need for a surgical procedure such as debridement and skin grafting, but they were not willing for the same. They were taught about hand physiotherapy, scar massage for the child, but the same was not followed and the child was lost to follow-up. There is no history of splinting or any surgical procedures, no history of ICU admission, no history of use of pressure garments, no history of burns to any other part of the body. The mother does not provide any history of difficulty in extension of the right ring finger of the child. The past history is not significant. Personal history, the child consumes a mixed diet, sleep is adequate and bowel and bladder habits are normal. The immunization history and developmental history are normal as per age. Coming to general physical examination, the child is active and playful, vitals are stable, pallor, itching, cyanosis, clubbing, lymphadenopathy and edema are present. Coming to local examination of the right upper limb, the child is examined in the presence of the mother in sitting position. There is full range of movement in the shoulder. With the contracture band extending from the metacarpophalangeal joint crease to the distal interphalangeal joint crease, that is of the middle finger. There is also a flexion contracture of the ring finger extending from the middle, from the MCP joint crease to the PIP joint crease. The metacarpophalangeal joints of the fingers. The MCP joint of the middle finger is in 0 degrees. An active flexion up to 90 degrees is possible. An extension is not possible. The MCP joint of the ring finger is in neutral at 0 degrees. Active flexion up to 90 degrees is possible. An extension up to 20 degrees is possible. Coming to PIP joints of the fingers. PIP joint of the middle finger is in flexion at 80 degrees and further active flexion of 20 to 30 degrees is possible. Extension is not possible. PIP joint of the ring finger is in flexion at 20 degrees. Further active flexion of up to 90 degrees is possible and extension is not possible. DIP joints of the fingers. The DIP joint of the middle finger is at 10 degree flexion and further active flexion of 70 degrees is possible. The thumb has full range of movement. Active and passive extension and flexion of all the remaining joints are, of all the digits are full. There is no web space contraction noted. Digits at all joints is full. There is no web space contraction noted. All joints are supple. There is no sensory deficit noted. And capillary filling of all digits is normal. Diagnosis is post-burn scar contractive deformity of the right hand, stern type 1, with gross flexion deformity at the third PIP joint and line section deformity at the fourth PIP joint. Investigations, I would like to do an X-ray of the right hand in AP, oblique and lateral position mainly for the middle finger, and do
Maybe what you could do is to summarize it. So, madam, it's also nice so that many of you are also late comers in the candidates. You just go through it.
This is a case of a 5-year-old child who was brought with history of scalp injury to the volar aspect of the hand 6 months ago, and the present complaint is difficulty in extension of the right middle finger since 3 months. History of present illness: the child presents with inability to extend the right middle finger since 3 months, which was insidious in onset and gradually progressive in nature. There is history of difficulty in eating and grasping large objects with the right hand. The child was apparently normal 6 months ago, after which she sustained burn injury to the right hand due to spillage of hot water while playing. There is history of blistering over the right middle finger volar aspect at the time of injury. The child was taken to a nearby hospital where she was admitted for 10 days and underwent regular dressings. The parents were advised about the need for debridement and skin grafting, but the parents were not willing for the same. They were also taught about hand physiotherapy, scar massage, and the need for pressure garments, but this was also not followed by the parents, and the child was lost to follow-up. There is no history of splinting or any surgical procedures, no history of ICU admission, no history of use of pressure garments, and there is no history of burns to any other part of the body. And the mother does not give any history of difficulty in extension of the right limb. The past and personal history are not significant. Immunization and development history are normal as per age. General physical examination. The shoulder, elbow, and wrist are coming to local examination of the hand. There is a flexion contracture of the right hand middle finger with the contracture band extending from the middle finger DIP joint crease to the MCP joint crease. There is also a flexion contracture of the ring finger extending from the PIP joint crease to the MCP joint crease. There is no deformity of any other fingers or web spaces noted, and there are no hypo or hypopigmented or hypertrophic scars noted. The MCP joints of the fingers. The MCP joint of the middle finger is at neutral at 0 degrees, and active flexion up to 90 degrees is possible, and extension is not possible. The MCP joint of the ring finger is in neutral at 0 degrees. Active flexion up to 90 degrees is possible, and extension up to 20 degrees is possible. PIP joints of the fingers. The PIP joint of the middle finger is in flexion at 80 degrees, and further active flexion of 20 to 30 degrees is possible, and extension is not possible. The PIP joint of the ring finger is in flexion at 20 degrees. Further active flexion of up to 90 degrees is possible, and extension is not possible. DIP joints of the fingers. The DIP joint of the middle finger is at 10 degree flexion, and further active flexion of 70 degrees is possible. The thumb is joints are suffered. Diagnosis is post-burn scar contracture deformity of the right hand, stern type 1, with gross flexion deformity at the third PIP joint and mild flexion deformity at the fourth PIP joint. I would like to investigate the child.
You said that the child's mother was advised some exercises and pressure garments, but did not follow it. Do you think any other advice could have been given that may have been more helpful to the child?
They were advised surgery not to try to
Did that give a what? They said no, but yet they went.
regular follow-up at least should
Any other active advice could have, anything else could have been advised that could have helped the child. You specifically said exercises and pressure garments. Do you think anything other than pressure garments could have been advised? That would have
specific to the hand. Specific to the hand.
specific to the
Any joints.
you have a burn and there is a contraction Yes. Don't you think that what would splinting do? If splints had been actually provided, what do you think